Women and girls in the Asia-Pacific region spend up to 11 hours a day doing unpaid care and domestic work. That's 4.1 times more than men. This work can include the care of children, the sick, and the elderly, domestic work such as cooking and cleaning, and community service, all done without payment. If the unpaid care work of women were included in the GDP measurements of the Asia-Pacific region, up to $3.8 trillion would be added. The COVID-19 pandemic and the introduction of lockdowns and school closures have greatly increased the time women and girls spend on household chores and caring for family. The pandemic has exposed society's dependence on women and is jeopardizing hard-won gains in women's rights. ESCAP is proud to launch COVID-19 and the Unpaid Care Economy in Asia and the Pacific, a report assessing the state of unpaid care work in the region and the policy measures that are needed going forward. The report finds that out of the 746 policies implemented by countries in the Asia-Pacific region to confront COVID-19, less than 30% are care-sensitive and only 12% are focused on women's care needs. Southeast Asia and North and Central Asia have taken the largest number of care-sensitive policy measures. But most of these policies do not differentiate between gender needs or recognize women's role in providing unpaid care. There's also the risk that these measures may be rolled back once the pandemic eases. Governments must seize this moment and invest in the care economy with a view to recognize, redistribute, and reduce unpaid care and domestic work. This is the report's 3 R's framework. It aims to empower women as economic actors while still recognizing that care is essential for the well-being of society. We need to recognize the value of carers. This involves gathering gender and care disaggregated data, recognizing women as equal economic actors, representing women's viewpoints, adopting a life cycle approach and recognizing intersectionality and diversity, and avoiding conditions that burden women. Steps must be taken to reduce the prevalence of unpaid work. To this end, it is crucial the region invests in physical and social care infrastructure so that women have more time to engage in economic, political, and social activities. Governments must also account for constraints on women's time, energy, and access to social protection measures. It's also time to redistribute care responsibilities so unpaid work is shared more equitably. This involves gender-responsive budgeting, paid sick leave and insurance benefits, social protection policies, social and physical infrastructure, and a norm shift for men to share care responsibilities. Women's economic participation and empowerment underpins the 2030 Agenda for Sustainable Development. It's SDG number 5, the goal to achieve gender equality and the empowerment of all women and girls. A commitment to reduce unpaid care and domestic work also formed part of the Asia-Pacific Declaration on Advancing Gender Equality and Women's Empowerment, reached after the Beijing 25 review. ESCAP's report adds to this foundation to achieve a more gender-equal society. As Asia and the Pacific weathers the COVID-19 pandemic, ESCAP stands ready, together with the UN family and our other partners, to support governments in the region to build back better, stronger, and ensure no woman and no girl will be left behind.